We're now live.
Thanks, Katie. Can we go ahead and start the roll call?
Yes. Mr. Antonio,
Here.
Mr. Badger,
Here.
Mr. Bleefeld,
Here.
Ms. Chiavacci.
Here.
Mr. Frank,
Here.
Mrs. Heyman,
Here.
Ms. Karinikis,
Here.
Dr. Morris,
Here.
Mrs. Ginsburg,
Here.
Sachi Mehta,
Here.
and Alex Zendaya.
Here.
9 present, 0 absent, and 2 student board reps this evening.
Thanks, Katie. Can everyone now please join me in saying the Pledge of Allegiance? Good evening, everyone, and welcome to the March 7th meeting of the Wissahickon School Board Directors. I just want to give an announcement that we heard that there might be a severe thunderstorm coming through this evening. And if that happens, we could possibly lose power here in the boardroom. So if you're on Zoom, you might get kicked off temporarily, but don't worry, our generator will come back on and then you can go ahead and log back on. So just give it a few minutes after the power would go out. But hopefully that won't happen. All right, going through our agenda. First, we have our prior meetings. We had a meeting last Monday evening, and we have a couple upcoming meetings. We have 2 on March 14th. One is a budget workshop at 6:30. We also have a facilities committee meeting the same evening at 7:30. The following week, on March 21st, there is a North Monco Joint Operation meeting, as well as a Racial Equity Oversight Committee meeting. Both of those are at 7 p.m. On the 23rd, the MCIU Board of Directors meet. And on the 28th, we'll have our next public work session, followed by another meeting on April 4th. Now we'll move into our presentation for this evening on the health and safety plan. Dr. Kinsfield.
Okay, thank you. Let me get my slides up. You want to do a test on the sound? Are we good? Paul or somebody? Okay, good. Okay, well, thank you, Amy. This is another opportunity for us to discuss health and safety in the Wissahickon schools, and specifically the updates to our health and safety plan as it exists now and as it's required by the State Department of Education. So the purpose of tonight's presentation is fairly straightforward, just to highlight the changes. And the presentation will take place now, and then we'll move to public comments after that. And then after that, the vote will take place. So it has to happen in that order so that everyone can see the highlighted changes, have an opportunity to provide some thoughts and feedback on them, and then the vote happens. So a very brief summary of recent developments. As we know, on February 25th, the CD issued their new guidelines. 3 days later, we had our meeting, which was a week ago tonight, and the board approved new masking protocols only. We only dealt with masking protocols last meeting, and those went into effect this past Wednesday. The Montgomery County Office of Public Health shared their new guidelines the next day, for the most part mirroring what CDC put out, but also notably affecting some contact tracing, which we'll talk about in a second. And then tonight we actually have the vote on the revised health and safety plan. Remember, this is a document that is required and it guides us over hopefully a long period of time. Nobody wants to keep revisiting their health and safety plan if they can help it. They're required to revisit every 6 months, and all of us are. And I don't know if it'll keep going into next year or not. But anyway, the less we can do that, the better. Okay, so big picture. The theme of the CDC and Office of Public Health changes is a shift in approach nationally. We're taking steps towards normal while keeping an eye on some new metrics. Now, the old focus, as we know, was to prevent transmission, and we had metrics like the positivity rate and case count per 100,000 people. The new focus is different. It's to prevent severity, A. And then also B has a really welcome, in my opinion, focus on protecting our hospitals. That is preserving the capacity of hospitals as well as protecting the people who work there from exhaustion, which frankly was a very big concern over the last 18 months. So our revised health and safety plan as exists on the agenda tonight reflects this change in focus. The severe cases can be, according to CDC, can be prevented with a combination of a renewed push for vaccines, with the new existence of therapeutic treatment drugs in case somebody has COVID. Those were two of the things that prompted them to move their metrics. Plus, there's a rather marked decline in the number of cases most everywhere, especially where we are. So the elements of the plan itself. First, it's broken down and we'll go over them. Masking, we won't have to spend too much time on this now. We did this all last meeting as we all very well remember. The interesting update is as of the 3rd of March, we were actually in low. You recall that and last Monday we were in, I think it was medium. I think that's the name for it. So we're actually in low status now. And so masks will be required if we ever get to high again. That's the CDC recommendations. And this applies everywhere, including buses. And just a note there that this has already been done. This was the vote. This was the one and only subject that was voted on last Monday. The next element of the plan that is a big one has to do with distancing. And this is going to be one of the main areas that reflects the new guidance, the theme or the focal points of the new guidance from CDC. And that is, we will preserve distancing. And I think I either misspoke or was misleading at the last board meeting when it was suggested that distancing does not matter. That's actually not true. And I thank those who point that out. It does matter, but what we're doing is we're going to take an approach to distancing that allows us to return to, whenever we can, normal operation of the activity at hand. This is a big change. So it can't be a blanket statement about distancing. It shall be 6 feet, it shall be 3, or any of that. It's going to be very much space specific and building specific. But there are examples all over where the current distancing practices actually interfere with the normal operation, such as on here it says eating spaces. That's the biggest one that comes up. Blue Bell students are eating on the floor of the gym because that's the only way we can get 6 feet in that school. High school students, as we heard last meeting, although some love eating in the audience, some, including a certain board representative, expressed a sentiment that it wasn't so great eating in the audience. And that gets in the way of our normal operation of lunch. So if an individual has needs about distancing, and there certainly can be many, and of course we'll work with families as best we can, but that has to be on a case-by-case basis. We just can't make a blanket statement about distancing and hold ourselves to it. This area or element of the plan undergoes a good bit of change. And while the masking one was largely driven by the CDC change, this area is largely driven by the Office of Public Health change. So there's a change in contact tracing where, and CDC agrees with this as well, it's reduced, not eliminated. So only in situations where there are 3 or more cases in the same place, like a classroom or like a orchestra or something like that, athletic team, that's when contact tracing, as we know it now, resumes for those situations, for those cases and people who they were near and contacts that they have had. Our nurses will continue to do that. The concept is for Office of Public Health to eventually get back to doing contact tracing for communicable diseases, but they are still overwhelmed. So our people will remain at the ready to do that, but it's not every single time we have a case. And that's an important change. The communication of cases continues to go to Office of Public Health. They are still the clearinghouse for that. But it's actually interesting because while the contact tracing doesn't take place as often, the communication of cases is actually ramped up a little bit. So that in addition to notifying the school and the classroom, when a case is known to us, that's a key point. Half the time, we don't get the information in a timely manner. Social media blows up as to how many cases there are in a particular place, and we have to, follow our tail. But anyway, there's a new requirement that I like because it gets at those situations where individuals or families are either very anxious or very high risk for whatever reason. So when we have high risk individuals who are known to us, that's a big qualifier there. It's our responsibility to reach out to them individually and see, just make sure they're aware of the situation and see if there's anything we can do to support. So it's actually an increase in the communication in a sense, in that it's individually based now. And there's a lot of question as to who is high risk technically. And, we know of some. We're working with the Office of Public Health on that definition. And we will, of course, comply with that new increased level of communication. And the isolation and quarantine provisions remain essentially the same. We have that optional mask to stay for students, the optional test to stay for staff. There are some new language pieces based on the new changes, but for the most part, those concepts stay, and you don't have to do those if you don't want to, but they're there if you want. These are the other sections of the plan. And I think an important point to emphasize here is all of these sections are actually remaining unchanged. We're going to do these things the same way we're doing them now. There's a big push at the national level for schools to help facilitate vaccination clinics, or in the case, if you're old enough, booster clinics. Well, we haven't done that in a while. We did that initially very successfully. We will, for whatever reason, I guess in certain areas of the country, this is a particularly acute problem. So they're really pushing that as a part of this new focused solution. And we'll remain ready to do that if it's called for here. We'll continue to coordinate all those things on there. We'll continue to do as we're doing them now. So the conclusion, we're moving closer to normal while maintaining a focus on safety. We still are super focused on the safety of our staff and our students. It might look a little different now, but it doesn't mean it doesn't matter any less to us. It matters quite a bit still. We are ready to pivot if we need to. And I think there was discussion at the last meeting, like, well, let's just always do away with masking forever. No, that's not what we're going to be doing. If we get to high, then we have to go back to masking. Again, the good news is we're low now, so we're 2 levels away from high. And so that's looking good, but we will be ready to pivot if we need to. And this is something, the buildings right now, in the buildings, like in the metaphorical way, but also the people in the buildings, the staff, the students, there's a level of exhaustion out there that's very real, that impacts everybody's mental health. The pandemic has really hit us on academic growth measures. And what we're aiming to do here is get us on the right track quickly and safely with kindness and commitment. We need to get back. We also need to continue to be cognizant of families' needs. And we also need to be cognizant of anything we can do to keep things as safe while getting back to as normal as possible. That's what this health and safety plan revision is designed to do.
Great. Thank you so much, Jim, for that update. Now I'll open up to board questions and comments. Who would like to start? Zeffie, go ahead.
Thanks, Jen. Several questions for me. One, and I'll do them one by one so that we don't lose track. So the first one is, now we had 3 days of mask optional. What would you say is your early kind of temperature read of how that's going, how the kids are adapting, how are the teachers doing? Are they, I know it's very early, but 3 days in, do you feel like we had a good 3 days? Let's start there.
Good place to start. I think the answer is generally yes. We've had a good 3 days. We had some of those pieces we thought we would have comments made from students to other students. We're on those immediately like hawks as soon as they're made aware to us or as soon as we hear them. Teachers expressed concerns about being in a room where there's so many people unmasked because maybe that teacher has a situation that, makes them feel that way. So we knew that was coming. We have had 3 days and frankly, as is always the case, the kids are the most adaptable. Everybody else should take a nice lesson from them and just sort of just get on with it. They wear masks sometimes they don't. Maybe I think in the high school estimate, like maybe 60-40 wearing masks still. It's okay. Elementary, maybe a little bit more as you get to the younger grades. And if you don't want to, that's okay too.
That's great. And those updates, I guess, would be nice as we hear them. So you said earlier that you'll be working with the Department of Health to get a definition of a high-risk student, it doesn't have to be a student and a high-risk person. But can you raise your hand and kind of self-select and say for reasons and not even divulge, be like, I want to be considered high risk? Is that something we could do?
Not to my knowledge, but if it would help us, I'm pretty sure what the outcome is going to be is we know of some based on health records. This will be the nurse's purview, obviously very private health records. And if somebody has a condition they either haven't shared with us in the past or like to highlight, we don't have the capacity to send out individual notices to 75%.
Oh, sorry. What I wanted to clarify is like me, Zeffie, walks to the nurse's office and be like, I didn't divulge this before, but there is, something about myself that I want to be considered high risk. So when there's a communication, like I'm in that pool.
The answer is yes. I mean, there's have to be a reason.
Right.
And I'm not sure what all the reasons are from the Office of Public Health, but absolutely. We'll keep lists, and that's the whole point. It's kind of tricky because there's not like a category to check off. Hey,
Right.
We do have some categories that could qualify. It's just gonna take a little time.
And then finally, you talked about this number 3 as 3 cases before we would kind of, take any action or kind of make some communication about things. But how do you define that, like in time? Like if Johnny's positive on Monday and Kathy's positive on Thursday and Elizabeth on Friday, is that 3 cases? Like how do you kind of put the parameters parameters around that so that we understand, like, are we talking about a really small window of time, a large window of time? Like,
A good question. Just, I should probably clarify, the communications don't depend on the number of cases. That happens no matter what, every case. The contact tracing is what you're saying. That depends on the number of cases. I don't have an answer to the number of days between, let's say in a classroom, if we have one on Monday, one on Wednesday, one on Friday. We would consult with the Office of Public Health on two things. One, does that get us to 3+? In which case we have to do contact tracing. We'll have to consult with them as to whether or not that is a yes or a no. And also we have to consult with them as to what to do about it. I know some questions like, okay, well, what if there's some, like a large number of cases in one class? Well, that's the same thing we've done here in the last 18 months. Talk with them, explain, they share what they know, we share what we know. They give us a recommendation or a requirement about, as you recall, we had a class go virtual one time. This was a long time ago. It feels like actually ages ago, thankfully. But that can happen. And that was the result of direct consultation with the Office of Public Health.
okay, great. So we'll continue to lean on them, the Department of Health, that is, to help us kind of distinguish these things. All right,
Yeah.
thank you.
Yes, you will.
Those were my questions.
Thank you, Zeppi. And just to follow up on one of Zeppi's questions regarding high-risk individuals, is it possible that our nursing staff could send an email out to their individual schools just asking families if you have a condition that you want them to know about, that you can share it with the nurse so that she is aware if there's somebody that's perhaps not already on her radar, then she does have that person on her radar or his?
Yes, that would be possible, but I'm just trying to have that with a tiny asterisk because that would, I think, generate quite a bit of work all at once for our nurses. So we want to be probably very sensitive to that. I don't know that we necessarily need to advertise this, but in the nurses, in their normal communications with families, they can make it known. I think I wouldn't want to do it immediately all at once, but and I wouldn't call it like necessarily proactive, but open for sure to more information. I don't want to have this nurses have to go and check 50 different applications. That's a yes, that's a no. I got to consult with Office of Public Health. That kind of thing might get incredibly labor intensive. So I'd say broadly speaking, like much of the health and safety plan, the nurses are open and they're empathetic to families' needs and they'll work with families as needed.
Okay, thank you. Who else has questions or comments? Marshall, go ahead.
I do. Based on the changes we made, I'd like to focus a little bit on the concerns of parents or families who weren't thrilled with the idea of going mask optional. And I know we talked at the last meeting that people would have the option of going virtual to the virtual academy if they chose. Do you have any idea so far within the first week, been a week since we voted, can you share with us either how many children or the percentage of families that have made a choice to switch either out of the virtual academy to in-person or out of in-person into the virtual academy?
At the secondary level, we've had, I believe, 3 inquiries and nothing finalized yet. We haven't compiled the information yet at K-5.
Okay. With regard to other measures besides masking, it's obviously a concern for a lot of people. If I'm not mistaken, in our original plan, what we stated was that we would be doing social distancing pursuant to the guidelines as feasible or practical. And one of the concerns I heard was that we have kids who are either eating on the floor or eating in the audion, which is never a good idea. Is there anything that we're doing now that we've changed it that is not in line with either the CDC or OPH guidelines with regard to distancing or more specifically with regard to lunches or things of that nature?
Not too sure I understand the question. I mean, if you could.
Sure. I mean, what I guess I'm trying to get at is, have they made a recommendation regarding lunches specifically? I think there's a big concern about when you eat, you have to take your mask off. Is there anything that we are not following in this perspective when we go mask optional relative to either the OPH or CDC, meaning they've said you must continue to do, or we recommend you continue to do 6 feet at lunches, regardless of where they have to eat or how they have to eat. Have we decided to go a different way or not follow their guide?
Okay. Well, first, remember that at the secondary levels, we're already not at 6 feet. We haven't been at 6 feet. We've been at 3 feet there, and that's including the audio. We can't get to 3 feet unless we have the audio on. So right now, we're doing all this. We haven't made any changes to distancing yet. We're waiting for tonight.
Is it feasible to have some space for students who do not want to switch to an optional masking situation, would like to wear a mask? Is there an option for them where we could have an area where they could eat and be comfortable under those circumstances?
The answer is yes. What will usually happen there is that the families will be worried about stigmatizing and that kind of thing. But what I would say is, if that's a desire on the part of the families, yes, we'll work with individuals, family needs, and meet their needs. But that has a case by case basis. So one of the elements of the revised guidance is to get away from using numbers and like 6 feet. I mean, let's be honest. The 6 feet was the best guess before Omicron. I mean, once Omicron got here, 6 feet didn't really, it's helpful. Distancing is helpful. So again, to the point last week, if we can keep up some distance, distancing, we will, but we aren't going to represent that it's always 6 feet at the elementary level and it's always 3 feet at secondary.
And then in regard to what I've heard the past week, terms such as on-ramp or off-ramp, if things should change, people are concerned that we may just not go back at any point because we've made the change. I believe even with the changes, there is a recommendation that if we go to that high level, which I think you said tonight, we would be reverting back to the guidelines relative to that, meaning mandatory mask if we are in the high level. Hoping obviously that we remain low, that's great news. But there is that quote unquote on or off ramp depending on circumstances.
Yes, that's clearly in the CDC recommendations, and our plan adopts the CDC recommendations.
I think that's all I have for now.
Thank you, Marshall. Anyone else have any questions or comments?
I do.
Oh, go ahead.
I'm here.
Amy, you were looking up there.
there.
I was thinking you were still.
I'm back today. Here I am in person. All right. My question, I have a couple, so bear with me. First is, we talked about students' illnesses that are reported to nurses, but sometimes they live with family members who are immunocompromised. And since this is a communicable disease, that's a big concern. Are they able to be accommodated as well?
You mean for notifications?
Yeah.
Yes, the answer is yes. That would be if there's a situation in the student's life, be it their own personal or something at home, that would need to be made known to us because we probably don't know it. But we keep it confidential, and we just have a confidential list of those who get the individual notifications.
So without the contact tracing 1 or 2 cases, and I guess the main concern of that is, or the main reason for that is just sort of streamlining the process and decreasing work as we move. But could we have a faster communication to the class to let them know? And reason being is, a lot of people in those class would be considered close contact. And so perhaps the parents would make the decision at that point to have their children masked for a few days post this known positive case if they knew fast enough. If in your example, Billy or whatever was positive Monday and I didn't find out till Friday, that's not really doing me any good, frankly.
I see the point. Yes, the answer is, as soon as we're made aware, I think it's really important to point out that other people know about either alleged positives or actual positives before anyone's thought about notifying us. And quite often, sometimes people choose not to notify us. So as soon as we're made aware, we have no reason not to get that notice out. It takes a tiny bit of time. It can't be instantaneous, but it doesn't need to take as many days as you just suggested for sure. I'd say maybe within 24 hours or even like maybe within that day. But the
Okay.
real problem is us knowing about the positive.
Okay. So we want to encourage people to report that to the district so that, we can make sure that we're, as a community, keeping our cases down, right? That is the goal of everyone, I think.
That's a really good point. And we have, and it's also something, I think was a point made at the last meeting, a question like, so what do we do when someone comes to school with symptoms? Well, they're sick and they shouldn't come to school. And they will be brought down to the nurse's office and sent home. And if it's the flu, then you stay home until you're well. If it's COVID, then you stay home according to the exclusion guidelines of the Office of Public Health until you're able to come back.
That's a great segue. So my next
I
question
had a
is,
feeling, yes.
about enforcing the masking coming back after the 5 days. So for example, my kids had COVID and they were still testing positive on day 7. And so that's a real concern to me because that means their viral load was high. I did not send them to school, but I could have. And I will put my kids in a mask. I will put them in a KN95 mask, but can we enforce everyone doing that? Or how can we? I think that is a concern of a lot of parents.
You think you're talking about like the mask to stay?
Correct.
Yeah. So mask to stay is
Or
going,
mask to come back, excuse me. Like mask to stay, I think, is if you're a close contact and then you wear a mask to stay in
Okay.
school and you don't get sick, but at post-COVID coming back day
That's it.
5 to 10.
we are not going to be able to keep track of which student is on day 5, which is on 7. That's a flaw in the system unless we all get to the point of trust. And the only way, I've spoke at length with our nurse about this, and the only way we'll really be able to track, I couldn't sit here tonight and say we can definitely track who's supposed to be in day 6. That would be like 2 full-time jobs at every school. So this is a good example of the community migrating to a place of trust. So if your family knows that your child has to mask, we are going to just have to trust. We will certainly notify, but we can't verify. It's just too much.
Okay, so my next question is about, and my questions largely focus on elementary school because those children aren't necessarily old enough to make decisions for themselves about this, but for like assemblies and large group gatherings in schools, I think some parents feel comfortable if their child doesn't wear a mask in their classroom of 22 kids, but what happens when the whole school gets together? Like, can the teacher remind students, maybe you want to wear a mask, we're going to a whole assembly, or I don't know, what role is the school versus the parent have at that point? Because they're just so young,
I can envision teachers of younger students pointing out that we're going to go to a assembly now, and if you want to wear a mask, that's fine. If you don't, that's okay. It's sort of like a reminder of the general rule, but just bring up a prompt about masks so that if Johnny happens to remember that mom told me to wear a mask whenever in assembly. Now, Johnny might have a convenient memory, and there's nothing we do about that, but I can see a sort of age-appropriate sort of system of like prompts or reminders, not suggesting you might want to wear a mask, but hey, remember masks are optional. Said slightly differently.
Yeah, and I'm not trying to put more on teachers. It's just nerve-wracking as a parent of a young student who is really shouldn't be making those kind of decisions, I feel, but okay. And my next question is about lunch or snacks, specifically in distancing. So like at the high school, they have the option to go eat outside. There's a nice courtyard with some tables. Wonderful. Elementary does not have that option. So if they don't have the option for distancing at snacks and lunches, then that kind of negates the issue of them wearing a mask all day. So without being a pariah, are we able to like really incorporate having the same distance? Like at Lower, I know at Bluebell, obviously they shouldn't be eating on the floor, but like at Lower Gwinnett, will they keep that? Or are we going to go back to the way it was? Can you clarify that? Or is that
Sure.
a building by building basis?
Both. It's building by building, but it depends if the area we're talking about, in this case, the lunchroom, can have a relatively normal experience without being disrupted. So to Point Bluebell, no. But we're going to, it takes tables in the foyer area there and some other places on the stage to get to 6 feet. And again, the guidelines are moving away from 6 being a magical number to distancing if you can. So we might say at a school, Lower Gwinnett or somewhere, it might end up being 5 moving forward. It will be less than that at Bluebell because of Bluebell's space constraints. But people aren't going to go back to 1 just because they can now. The direction the schools will be maintain distancing as long as it doesn't disrupt the normal activity of whatever whatever is at hand.
And I think some people have concerns about distancing or other mitigation strategies disrupting normal plans for their children. Are we still going to be able to have the dances, the proms, the pep rallies, all the things that kids love? Are we still having those without any issue? Can you confirm?
Unequivocal, yes, we are.
Okay, so no issues there. And my last question, thank you for bearing with me. How fast can we go to masking if we get to that red status? Is it the next day, like the county says, hey, we're in red, and the next day Wissahickon is masked up? Just curious.
We're pretty fast at moving away from masking, so I think we could probably mirror that and be pretty safe.
Thank you.
Dan, any other questions or comments?
I have a question. No comments from myself, but I'm curious to get a perspective from our 2 student board reps, Sachi and Alex. With the past week being at least partially mask optional and with the proposed changes to the health and safety plan, any thoughts you can share about your personal experience and thoughts about the changes?
Yeah, I can definitely talk about that. I feel that everyone's been doing very well. Being inside and outside of the classroom, I think everyone's been very responsible.
One second, we're having some sound issues.
Can everyone hear me? It's working out. Okay. I was just gonna say that being in and out of the classroom, I feel everyone's been very responsible, respecting everyone's decision. And so far, what I've witnessed, I haven't seen any problems go on. And is it still going? Is it still good?
I can't hear you right now.
Get time out.
We're trying to fix the audio, so give us a moment.
Don't forget all those good things you were saying. Maybe I guess it's a test.
All right, while we're waiting to correct the audio issue, does anyone have any comments on the board? Okay.
Alex, are you with us?
Yeah, I'm here. I think the audio was not going online. But can you guys hear me now?
Alex, can you try to say something again?
Hello, can everyone hear me?
Okay.
Was it working?
We can hear you now. Great.
Okay, perfect. What I was trying to say was I think being in the building, everyone's been very respectful of everyone's decision, whether it's to wear a mask or not. And from what I've witnessed so far, I think there hasn't been any issues. And personally, I think this has been the right decision. Just bringing back like some sense of normalcy. And it's just improving like the learning environment, seeing your teachers, seeing the seeing like emotions on their faces, and just adding to that overall education.
Thanks. Sachi?
Yeah, and I also wanted to reiterate that same thing. Honestly, I'm really happy with the way that things have changed. And I feel that, like Alex said, people have been really respectful of other people's choices, even though despite what we heard maybe at last board meeting. And after hearing those kind of conversations, I was a little bit apprehensive and nervous that there might be a lot of judgment passed on someone's personal decision, but I'm really happy to say that it was a seamless transition. For the most part, we have seen one or two instances of maybe some disrespect, but I'm really happy that it's been pretty good for the most part.
Great. Thanks, guys.
Jim, are teachers able to request that students wear a mask in their room if they are high risk or have concerns?
No, we don't have that provision.
Is it just because? Why? Sorry.
Well, we don't have any provision where someone can tell someone else to wear a mask. Actually, what the teachers will do in that situation is they'll take some precautions. They can craft their lessons to have distancing from people, they themselves. And we're focused on the efficacy of one-way masking, and research that shows that can really protect yourself as long as you're vaccinated and boosted and a proper mask.
I'm not saying anyone makes them do it, but could they request it?
I think it would make people feel awkward.
Okay.
I have a question.
Sure, Paul.
So I actually had a couple, but most of them have been answered. But I do have one remaining. So it's kind of a follow-up on one of Deanne's questions regarding how we're allowing students to return. I think the efforts that you're putting in place are terrific. One remaining concern, though, which I think adds to our risk levels, is when and how students come back after a positive case. And I fully appreciate the trust factor that we all really need to build, and I hope we'll come back to our community and beyond quickly. But in addition to that, one step that I think would be extremely helpful is to require a negative test for students returning. It may not be one of the CDC requirements at this point, but if we have a gap of students being allowed to return day 6, but we've all heard from our community that people are proactively testing their children, and there's still positive cases day 7 and 8, and sometimes beyond. That gap can leave a lot of risk that we may be subjected to. So has thought been given to requiring a negative test for students coming back, which would alleviate all of that potential increased exposure?
We just went with what the Office of Public Health recommends with regard to the contact tracing, quarantine, isolation, return to school realm, only because we didn't want to get into the business of trying to decide if what they're recommending is a good idea or not. We just took what they were recommending. I hear what you're saying, that there are ways to make it more restrictive. We had not contemplated doing that.
Would that be something that could feasibly be added to this if case counts start to go up again? Again, I know we don't want to keep revisiting this, but I'm trying to figure out reasonable solutions that will maximize the opportunity to keep our kids in school.
That's a really good point. The answer is, while I wouldn't recommend hardwiring it into the health and safety plan now, the answer is absolutely. If we get to a situation where enough people are uncomfortable, or if things looking different, or if there's a new variant or whatever, and even if the case counts or the level is not at the but it's something else is at work that makes people feel uncomfortable. The board can make a change to this health and safety plan anytime in the future. And for that matter, Office of Public Health may well change their recommendations as well. If they change their recommendations, the nice thing about the plan is we don't have to go revisit this thing as much as we all like talking about this. We prefer not to have it be dominating public meetings. So we have built-in flexibility. But if the board sees something that they don't like or gets an uneasy feeling and say may or whatever, absolutely, yes, it can be revised.
Thank you.
Yeah, I think Paul makes a good point, and I agree with him on a very personal level, but like in terms of Jim, what you were saying, like a level of what is our role versus what is the role of the Office of Public Health. And I think we should, and we have sort of deferred to them. And even if I don't like certain parts of it, I think that's better than trying to add in our own provisions, I guess, on like a whole. I think the one theme we're really hearing here is that we really need to depend on each other and this community and start trusting each other and doing the right thing, keeping your kids home when they're sick, making sure they're not still ill when you're sending them back to school, putting a mask on when appropriate. And I think that's hard to, when your health depends on someone else's decision, that is a hard thing to face for so many. So, you know, I think that's been a theme of this pandemic. That's why I believe in public health so much. So that's why we all need to get vaccinated and do our part in trying to prevent the spread and keep us at a low level. I think we could recommend vaccination. We could make strong recommendations, right, to wear high quality masks. I don't know. I just think we should make those recommendations. I know we can't make anyone do anything, but I'm hoping that people do follow the guidance.
Thank you, Deanne. Anyone else? Questions or comments?
I don't have any questions, but they've already been asked. I just would like to comment that I do agree with those that have suggested it's important to maintain distancing at lunch for those students that want it. If we can make that readily available without a difficult process, I think a lot of families, or some, might want to take advantage of it.
Thanks, David. Anyone else? Okay, we'll see no more comments. Then we'll move on to our first public comment period this evening. And normally we allow 5 speakers on any particular topic. In light of the fact we're talking about the health and safety plan this evening, we may have more, so we'll allow 30 minutes of public comment. I have 1 in person. I'm not sure how many we'll have online. But when you come up to the podium, please state your name, municipality of residence, and the topic on which you're speaking. And this first public comment period is for agenda topics only. Thank you. And first speaker is Carmina Taylor.
Came dressed in my gold and blue, right? So I'm speaking as an alum and as an advocate for families in the district. Question for Dr. Crestfield. I really was impressed that you talked about moving with kindness and commitment. So my question would be, what does that look like from the district? As people were talking, it seems like there are things happening in the schools to make really good accommodations to the change. I know you don't have to talk now, but that would be my question. What does kindness and commitment look like with this plan coming from the district on down? And I just want to take a note about the trust factor. I think you guys as a school board, there could be community trust if you responded to them to have a community conversation. Trust is built. So the only way that you can build trust is really have your skin in the game and respond to them and talk to them and engage with them. That's all I have to say in regard to the health and safety plan.
Thank you, Carmina. Katie, do we have anyone online?
We have 2 speakers on Zoom. The first is Kara Finn.
Kara, you can go ahead and unmute yourself.
Hi, can you hear me?
Yes.
Great. Hi, my name is Kara Finn. I live in Lower Gwinnett. I have 2 elementary age children, and I'm commenting on the proposed updates to the health and safety plan. I wrote these comments after reading the plan this afternoon and before the presentation, so I apologize they're not as polished as I was hoping for. First of all, thank you for all of your hard work to date, keeping our children and community safe. We are in exciting times with case numbers dropping and steps towards normalcy beginning. However, the pandemic is not over for more vulnerable members of our community, and no one can predict if this was the last surge. Therefore, I am commenting to encourage the district to be proactive and to also ask the district to make it easy for students who are higher risk or have high-risk family members to remain safe. While I generally support the proposed plan, I do have some concerns, and some of them were already brought up by board members. The CDC does recommend that those who are COVID positive quarantine for 5 days, and if they are symptom-free, they can resume normal activities, but should strictly mask for another 5 days. I encourage Wissahickon to consider adopting this masking requirement for students and staff who test positive and then return to the best of your ability, even if you can't strictly police it. I also ask on distancing. A lot of folks have brought this up. Before you make distancing changes, please give people the opportunity to stay distanced during meals, however that would look for those schools. Please don't make those changes before you've had the opportunity for those folks to speak up. A big concern is that it seems like the district might be setting itself up for outbreaks if contact tracing only takes place in the event of 3 or more cases, and not in the event of 1 to 2 cases, especially with masks optional. This is generally a comment. This doesn't seem very protective against outbreaks, and I would encourage you to reconsider. I also think the district should be proactive in working with the Montgomery Health Department on setting a threshold for action in cases. Figure that out before it happens so you're not left scrambling. Let's see. Oh, also for assemblies, please notify parents in advance and provide them an opt-out option for their children. And thank you for continuing to offer classroom notifications, and also for putting together a plan that allows you to pivot quickly if needed. And thank you again, just for all of your hard work and following public health guidance. You are all appreciated.
Thank you so much, Kara. Katie, do we have anyone else registered? Who's next? Melissa Chargle. Melissa, you can go ahead and unmute yourself.
Hi, my name is Melissa Chargell. I have a first grader at Shady Grove, and just to throw it out there, an unvaccinated 4-year-old at home. I just have a few questions, and I know you don't respond to public questions, so just to have out there. I've noticed, and just like Kara, these are based on some of the comments that came up tonight, so I might be all over the place and unpolished, and I apologize. So first, if we're starting to see, now that we're in the low, and we're starting to see, we know in the news that there's a new variant out there, and all of a sudden we're in medium and it keeps creeping, you know, how does that look for those of us who, you know, see the signs and want to be proactive? Talking about, you know, can we decide to keep our kid home? Now, the next question to that is, I know it's my understanding that after 10 days, we get a letter in the mail. I don't know if that's through truancy. I'm not exactly sure how that works. You know, I'm new to having my kids in a public school. But how does that work for us, for those who want to be proactive, or for those of us who our kids have a fever and we're not exactly sure it's COVID? I'm just curious how that looks. I certainly don't want my daughter to be penalized because I'm trying to keep the public safe. I echo what Kara said about separating during lunch. You had a very panicked email from me last week about all of a sudden thinking that my child would be eating without a mask and without space restrictions. And as I said, you know, masking is optional, but eating is not. So just like Kara said, I would like some time to express my opinion to the principal and look for ways to accommodate my child, because that's simply not an option, and it wouldn't be fair to force her to go virtual just because of it. You said you will not tell anyone to mask. I have a first grader with ADHD. Sometimes following directions and impulse control is an issue. Can we, in some way, shape, or form, I don't know if that's an IEP, request that the teacher direct the child to mask in these situations? I wanted to make sure that with the notifications with the immunocompromised, or however, you wanted to notify the nurse, that does include family members. That was brought up, and I think that's critical because some of us have family members that we need to take care of that aren't necessarily in the public school. And I also want to say that I believe that we should be moving slow. Takeaway masks being required. Let's see what happens. Watchful waiting is what I think would be best. Thank you.
Thank you so much, Melissa. Katie, is there anyone else registered?
There are no other speakers on Zoom.
All right, thank you so much. And we have no other anyone else in person. So we will move on from public comment then to the board president report. I have no informational items this evening, but I do have one action item, which is the approval of the school board public meeting dates for 2022-2023 school year per document 6-1. Can I have a motion to approve those?
So moved.
Second.
The motion has been made and seconded. Are there any comments or questions? Seeing none, all in favor?
Aye.
Anyone opposed? All right, motion passes. Thank you. We'll now move on to the superintendent report. Jim?
Thank you. I do have one informational item. You might remember that we were going to initially, for tonight, have the rough draft schematic drawings for the Bluebell construction project, if it's even feasible. That agenda item was overtaken by certain other agenda items. So the new plan is to have those schematic drawings, rough draft, shared out with the board at a facilities committee meeting next Monday. And we were going to share them out with the Bluebell community 2 nights from now. That will instead be 2 nights from following Monday. So everything just got pushed back a week on that. There will be opportunity to see them. I don't have anything else to share, information to share. It's just that it was going to be tonight. It's just going to be next week instead. And having said that, I do have an action item, which is to approve the amendment of the district's health and safety plan for the 2021 to 2022 school year, dated March 7th, 2022, to reflect revised COVID-19 mitigation procedures and protocols per document 7-1. I can get a motion for that, please.
So moved.
All right, the motion has been made and seconded. Do we have any further comments or questions?
I just have a quick one.
Sure, go ahead, Deanne.
Do the nurses feel good about moving to contact tracing from a singular case to more than 3 or more cases? Is that something they think is appropriate at this time?
That's a good question. It's kind of loaded because they're the ones who have experienced the burden and the exhaustion of the contact tracing. And one of the things is I don't know how they feel about the new focus on preventing severity of disease versus transmission. I can tell you there was a sense that there was so much work being done, and then yet we weren't sure about this contact situation, or we didn't hear about that weekend one, or if it was a foolproof, high confidence contact tracing, that'd be one thing. It was an incredible amount of work on their part, and they did trace and as best they could. I think that this just gets us to, we might have like 3 or more in one place. That could be what the guidelines call an outbreak. Yes, that's when we got to knuckle down again and do all those things. So all the skills that they've learned and all the tricks that they know will not be forgotten. They'll just be reserved for the high impact times versus every time.
Jim, I also wanted to ask, the letters that the speaker referenced that we send out after you're absent a certain number of days, do the COVID days count towards those days?
It's sort of. But I think one of the impacts of the pandemic is that certain things have been continue to be followed, but with a little asterisk. And I'm going to give you a good example of one, which would be the standardized testing. We were required to do that, and we'll have some results to everybody. And just as everybody would have guessed, they're not as high as they normally are, and that's the same case everywhere. So we keep doing that because we're required. We keep sending those letters home because we're required. I'm pretty sure that there will not be, in fact, I can guarantee there will not be anybody who's adversely affected by absences. You're going to get one of those letters. It could be a little traumatizing. You will put it on a frame, maybe on your wall, because it's a little relic of the pandemic. I don't know. It's not going to impact you at all.
Okay. Thank you, Jim. Any other comments or questions, Rosetta?
Yeah, I just have one comment. I guess it would make me feel a little more assured that, with the contact tracing being, moved to like 3 or more, that communication when there is a positive case be quick and be thorough. I think that I would feel more confident in our ability to keep everything down.
That's a good point. Yes, the nurses do support that. Again, they get a little frustrated because there's a complaint about the speed with which we communicate, and nurses they throw up their hands like that's because no one told us. And so people think we're not communicating quickly when in fact we're communicating as quickly as it's made known to us. So I can assure you they're on board with that. And as soon as, and remember those communication protocols apply to even just one case, not just a 3+. And they are on board as soon as we are aware. There's no reason not to. And we do get the high interest level and high usefulness level of the prompt notice.
Can we just send out a reminder to parents after this is done to make sure everyone's on board with this is what we need to do as a community, right? Like reporting and all the things.
Yes.
Thank you.
All right. Any other questions or comments? Okay, well then we'll go ahead. I guess we could do a roll call vote.
Mr. Antonio,
Yes.
Mr. Badger. He said yes. Mr. Bleefeld,
Yes.
Ms. Kiavachi,
Yes.
Mr. Frank,
Yes.
Mrs. Heyman,
Yes.
Ms. Karianikis,
Yes.
Dr. Morris,
Yes.
Mrs. Ginsburg.
Yes.
9 yes, 0 no.
Thank you. The motion passes. All right, then we will move on next to our Assistant Superintendent's report. Dr. Tuan.
Thank you. This evening, I have no informational items and no action items on the agenda.
Okay, thank you. We'll move on then next to our board solicitor report. I think Michelle is with us.
Yes, good evening. I do not have any informational items. I do have one action item. It is a settlement agreement that was reviewed at last week's work session. So I'm looking for a motion to approve action item number 9B1.
So moved.
The motion has been made and seconded. Are there any comments or questions? All right, seeing none, all those in favor?
Aye.
Aye.
Anyone opposed? All right, the motion passes. Thank you. All right, we'll next move on to our board secretary report. Wade.
Thank you very much. There's no informational item and there's no change to the action item. So I'm requesting approval of action items 10B1 through 4.
So moved.
Second.
All right, the motion has been made and seconded. Are there any comments or questions for Wade? Okay, seeing none. All those in favor?
Aye.
All those opposed? All right, the motion passes. Thank you.
Thank you.
And Wade, would you like to do the board treasurer report?
Thank you very much. No informational item and no change to the action item. So requesting approval of action item 11B1.
So moved.
Second.
Okay, the motion has been made and seconded. Are there any comments or questions? Seeing none. All those in favor?
Aye.
Anyone opposed? Okay, motion passes.
Thank you.
Thank you, Wade. Next, we'll move on to our Director of Human Resources report, Danielle.
Good evening. For tonight's HR report, there are no informational items.
Changes from the work session last week are represented in bold on the agenda and are found in document 12.1. These include additional resignations and appointments. Item 12.7 was also added. This is an agreement for a teaching assistant on special assignment. This evening, I am seeking approval for action items 12B1 through 12B7. Thank you.
So moved.
Okay, we have a motion. It's been seconded. Are there any comments or questions for Danielle? Seeing none, all those in favor?
Aye.
Anyone opposed? Okay, motion passes. Thank you. All right, we'll next move on to our committee reports. Communication committee reports, Zephy.
So no informational or action items, just FYI from last week, we'll no longer be covering the COVID cases during the session since we're in low until we're told otherwise. And then we'll be bringing in other communication items as needed moving forward.
Great, thanks so much, Zephy. Are there any questions for Zephy this evening? No? Okay, then we'll move on to our curriculum and technology committee report. Ronnie?
There are no informational items. The action items we reviewed at the last session. So all we have to do is vote. Oh, there's one more. Do you do it?
Yes, thank you. There's one new item, action item 14B6 has been added. This is for the technology surplus bid that's directly related to action item 15B1 regarding obsolete equipment under the facilities and transportation committee report. So we're recommending that the technology surplus bid be awarded to Iman International Incorporated as the highest bidders, meeting specifications for $43,750. That'll be revenue. There are no additional action items, as Ms. Heyman mentioned, were reviewed last week. I know that there was one question about the field trips. Am I permitted to follow up with that?
Sure, thank you.
Regarding the cost for students, the $800 was sort of called out. I'm looking this way because I feel like it was over here. Okay. And so I did look into that. So they do have fundraising that happens. There are district funds as well. So students are not accruing that $800 cost. So I wanted to reassure you of that. So that concludes our report this evening. We're looking for a motion for action items 14B1 through 14B6.
So moved.
Second.
Okay, it's been moved and seconded. Are there any comments or questions?
Just a comment. Good job, Wade.
All
Finding
John.
money in every quarter. I love it.
That was all John McGowan. Thank you.
Thank you, John, then.
Any other comments or questions? Okay, seeing none. All those in favor?
Aye.
Anyone opposed? Okay, motion passes. Thank you. All right, next we'll move on to our Facilities and Transportation Committee report. Joe?
Thank you. No informational items this evening. And action items 15B1 through 5 were all reviewed and discussed last week, and there have been no changes since last week. So with that, I'm asking for a motion to approve action items 15B1 through 5.
So moved.
Second.
Okay, there's been a motion. It's been seconded. Are there any comments or questions? Okay, seeing none. All those in favor?
Aye.
Anyone opposed? Okay, motion passes. Thank you. We'll next move on to our Finance Committee report. David?
Thanks, Amy. We have no informational items tonight. There are no new action items. We covered those last week. There are a couple of typos that were corrected in action item 16B2 and 16B3 to correct the years. Otherwise, all is the same. We're asking for approval of action item 16B1 through 4.
So moved.
Okay, the motion has been made and seconded. Are there any comments or questions? Nope. All right, seeing none. All those in favor?
Aye.
Anyone opposed? Okay, motion passes. Thank you. We'll next move on to our Policy Committee report. Marshall?
Thank you. We have no informational items this evening. In terms of our action items, there are no changes from the last meeting where we reviewed 17B1 through 13. So I am asking for a motion to approve action items 17B1 through 13.
So moved.
Okay, we have a motion that's been seconded. Are there any comments or questions? Okay, seeing none. All those in favor?
Aye.
Anyone opposed? Okay, motion passes. Thank you. We'll next move on to our Racial Equity Oversight Committee report. Paul?
Thanks, Amy. We have no new informational items and no action items this evening.
Okay, thank you, Paul. Any questions though for Paul regarding the Racial Equity Oversight Committee? No? Okay, thank you again. All right, then we'll move on to our report of board representatives. Extracurricular, Marshall?
I have nothing official to report. However, I would like to say that for those of you who had the pleasure of seeing the musical this past weekend, Sondheim on Sondheim, it was incredible. The students were amazing. We have a level of talent that you can't find anywhere else, I'm sure. And it was a treat for anybody who went and enjoyed it. So I hope you got to go. And my congratulations to all of our students, all of the people on the crew, our staff, and the parents and families who also enjoyed it. It was really, really wonderful to see everybody performing.
Thank you, Marshall. I will second that. My family loved it. It was wonderful. And it was great to see, I saw a number of board members there. So it was great to see everybody out supporting our theater club. All right, well, then we'll move on to my MCIU reports. I have both my legislative report and my board of directors report. A couple of legislative matters. First, on school meal standards, the USDA finalized its proposed rulemaking on 2/7, and the final rule will become effective July 1st. They address things like sodium standards and the % of whole grains in lunches and breakfasts. It's also allowing schools that participate in the National School Lunch and Breakfast Program to offer low-fat flavored milks. The House and Senate are in recess to facilitate respective appropriation committee hearings on the governor's proposed budget. The House will return on 3/21 and the Senate 3/28. The governor's plan included things like a $200 million increase in special education, which was a 16.7% increase, a $60 million increase for pre-K counts, career and technical education increase of $6 million, and student transportation increase of $16 million. He also outlined, this is the governor, Governor Wolf also outlined the need for a comprehensive charter reform to make sure they're providing a high quality education, are accountable for academic performance and financial management, and are meeting expectations set for traditional public schools. He also talked about applying special education funding formula to all charters to better align special education funding with the actual cost. This was a recommendation from the Bipartisan Special Education Funding Commission, and the governor estimates that this will save districts an estimated $174 million annually. I've mentioned before the school funding lawsuit that goes all the way back to 2014. They've had now a 4-month trial, and closing arguments are set to start on 3/10. There are also some charter regulations that were submitted on 2/10. And those are some of the things I mentioned earlier, though. They're covering several elements of charter school law, such as setting clear application requirements for opening a charter school, ensuring students can access charters, clarifying ethic requirements for trustees, and requiring charters to follow the same fiscal management and auditing systems as school districts. So those are some of the legislative matters discussed. At the board meeting, Dr. Landis, he announced that the Pennsylvania Department of Education was holding its statewide special education conference in Hershey. That actually already now at this point has taken place. It was March 2nd through 4th. Dr. Landis also showed that Montgomery County Workforce Development Program received a $100,000 grant to support their growing program that assists secondary students in Montgomery County explore and prepare for employment opportunities. We approved a memorandum of understanding between the MCIU Board of Directors and the MCIU Education Association regarding an early retirement incentive program. We also improved various budget items, including next year's Head Start budget, which is approximately $4 million, transportation services budget of approximately $11 million, and facilities and operations budget of $4.5 million. And that covers what we discussed at that meeting. And then we have a bunch of upcoming meetings in March and April, including a hiring event. We have our policy council meeting. We have an education diversity fair coming up. And I think we've all gotten the postcard now for PSBA Day on the Hill, but they also mentioned that date coming up. So that is my report. Next we'll have our North Monco Technical Career Center report. Oh,
Sorry,
did you have a
Amy,
question? I'm
I
sorry.
did. Is the Head Start program like the pre-K program?
Yes, that's my understanding
So
of it.
Are they expanding the program and are new schools able to like apply for it? Because I knew the old program was like on an application basis.
Oh, I can ask that question if they're expanding it.
Yeah, because that would be something of interest for sure. If they're
Definitely.
increasing funding for it, maybe there's new opportunity there.
I'll ask that at our next meeting. Thanks, Epi.
We have a head start at Ambler Borough Hall, right?
The issue is space. So there was a discussion. We had the Head Start program at Lower Gwinnett for a period of time, but based on space needs, which quite frankly at the elementary level are going to continue for a little while, that's one of the reasons that the program moved.
Okay, but that's our district program. It's just at Ambler Borough Hall, correct?
I don't know that you would call it a district program. It's run by the MCIU. It's for the community, but that program used to be at Lower Gwinnett. Yeah.
Were there any other questions?
Yeah, just a quick comment on Head Start. My understanding is that it's based on, there's a low income requirement for participants in Head Start. And in essence, the MCIU has gotten a grant from the federal government to run a Head Start program. And they put locations for the program in, all around Montgomery County. And it's meant to kind of draw and serve low income families with pre-K options, again, in the area here. So I think the challenge for them is just looking for enough space. The county itself has I think a significant amount of space in the new office space that they've been renovating. But I think that's the biggest constraint they have, offering more seats elsewhere in the county.
Any other questions? Okay, then we'll move on to the North Monco Technical Career Center report. Ronnie?
Kevin?
Or David?
Nothing since our last meeting.
Okay, then we'll move on to our PSVA report.
There was no meeting.
Okay, thank you. Then we will go ahead and move on to our second public comment, which is on any school-related topics. We'll allow 5 speakers on any particular topic. You're given 3 minutes. And when you come to the podium, please make sure you state your name, your municipality of residence, and the topic on which you're going to speak. And it's not our practice to engage with speakers. If appropriate, we will follow up with a response online. There's a lot of feedback. Sorry about that. Okay, our first speaker this evening is Amy Hughes.
Hi, Amy Hughes, Ambler Proud. So I think I sent an email on a lot of it, but the majority of what I want to talk about tonight, I guess, ultimately centers around guidance counselors. And I know that there is, a push to get more of them in. They're desperately needed. I feel like our kids are not just behind, over a full year academically, but emotionally and socially. And I'm really concerned about the games that are playing at the middle school that are horribly inappropriate, the fighting at the high school. This is not, things that are specific to our district by any means, but that doesn't mean that we can just ignore them. These are our kids, and I think that we can do a little bit better by them. Until we get more guidance counselors, my kids don't even, they can't get in. I mean, just for course selection, it was a nightmare. They're hard to get a hold of. We've got to give these kids some resources. Their social skills are terrible. The bullying, the disrespect to teachers. I mean, it's almost abusive what our teachers and staff are dealing with at the high school level in some cases. I feel like there's got to be other resources out there to help these kids. The other thing that I wanted to talk about is internet security. Cybersecurity is part of what I do for a living, so I'm a little bit sensitive about it. But I feel like the district does have an obligation to do a bit better where that's concerned, simply because we're providing these kids with devices. My personal experience, the difference between 5th grade and 6th grade, the security is far better at the middle and high school level. Now they're still playing Minecraft and Roblox in school on your computers. They can do things on those computers that we don't know how to do. But they are much better monitored at the high school level. These kids need to be taught just how dangerous the internet is. Typing in one wrong thing, and who knows where these kids could end up. Their passwords are private. Let's teach them that they're private and we don't share them with other people. I think we can do more, and I don't think that it's going to cost the district a whole lot of money. I think that there are assemblies. I think that there are programs out there. There's a lot out there. I think we can find it and really do something on this topic. Thanks, guys. It's good to be back.
Thank you, Amy. All right, our next speaker is Carmina Taylor. Carmina, oh, actually, do we have anybody online? I'm sorry, I should go back and forth. No, okay. Carmina?
I'm back as an alumni and as an advocate. I don't know if this is a Wade question, but I was just curious. I keep coming to the school board meetings and I keep seeing the special education settlements. And I was just wondering if we could find out how many have been issued in the last 2 school years. Is that a right to know request? It is. All right, I'll give that to you tomorrow. All right, so 2 minutes. Question on the race and equity. I'm looking at the meeting minutes from February 14th. I'm really curious because this affects the people that I work with in this district, the parents. If maybe someone could answer what are the current practices that are in place that is addressing the disproportionality of Black and Hispanic students enrolled in AP courses. The minutes is not descriptive, so I just thought I'd ask that question. And then the second one is the Belonging Climate Survey. Just curious as to what are the current climate tools that are being implemented in the school district. Thank you.
Thank you, Carmina.
I have 4, but Amy, I do want to ask this. This is a policy question for the board. If you have 3 or 4 different topics that you want to talk, I don't think it's fair to do it in 1.5 minutes. So I think you have to address, like if you have a barrier of, or you can only have 5 people that can speak on one subject, what if one person has 3 subjects? Not that we have to be there 15 minutes or 12 minutes, but I think you have to take into consideration that you can have multiple subjects and it's difficult to put that in 3 minutes. So I'm just putting it out there.
Thank you, Carmina. Katie, is there anyone registered online?
There are no hands raised on Zoom.
Okay, thank you. All right, then we'll move to board comments. Do any of my fellow board members have anything they would like to share this evening?
I have a quick question.
Sure, go ahead,
Do we have a class that teaches like internet skills or like how to navigate or verify the information sources from which you're getting things on the internet? Anything like that or no?
I'm sorry, I was trying to navigate the hand raised on Zoom. If you could just.
I'm just asking if we have any class offered that talks about like internet safety or like how to determine if like where a source of information comes from on the internet.
We have lessons. We don't have like a standalone class, but yes, we do. And I like the idea of paying attention to the transition from elementary to middle. We'll be on that.
I have one more question. I'm sorry. It's about the health and safety plan though. As we pass this tonight, and are things changing like tomorrow morning or how are you envisioning this working with students requesting accommodations?
Well, I would say that the health and safety plan is in effect. I would say that our principals are very good at understanding the impact that these changes, be it masking or distancing, contact tracing, notifications have on families. So we'll get the word out first. before changes happen, and we give opportunities, I think it was expressed, for families to share with us if they have a need of some sort. We're not rushing to do these things. And I think that was one of the themes from the other meeting that I was hoping to land, which is we're changing, things are getting better, we're going back to normal, but we're going to do it in a way that's full of kindness and commitment.
Thank you.
Thanks, Dan. Paul, did you have a question? Does he?
No.
No, okay. Oh, yeah, we had another comment. I'm sorry. Let's go back to public comment. And who is this, Katie?
We have Mrs. McGovern.
Okay, Mrs. McGovern, you can go ahead and unmute yourself.
She's unmuted, but we don't hear anything.
Are we having audio issues again?
I don't think so.
Okay, Mrs. McGovern, unfortunately, we cannot hear you, but I would encourage you to email the board your comments for this evening, and we can take a look at those once we receive your email. I'm sorry we aren't able to hear you. Okay, are there any other board members that have questions or comments this evening? Kathy?
Yeah, I think Amy, our speaker from just a little while ago, brought up some really good points, both on the counseling part and the cybersecurity. I know we have finite resources, but I agree, using assemblies to kind of remind on some things would be really helpful. In my company, I have to do cybersecurity once a year. It's like a requirement. I think most Fortune 500 companies have to do that nowadays because of everything that is happening. And it's a quick, it's a little video with infographics, and you have to pass the test and you're cyber secure. And then for counselors, there's probably major themes we can cover. Bullying, what's okay to share, what's not okay to share. I mean, I think we can just kind of think about those things. I know we've been kind of in a COVID haze, but now that we're maybe coming on the other side, we can focus on some of these other elements moving forward. Thanks for bringing that up.
Yeah, I completely agree. I think we should also, as part of this cybersecurity class, be teaching students how to communicate better online. I feel like there's a lot of fighting, and that carries over then sometimes into the school. And if we can teach our kids how to communicate better online with one another, I think that would go a long way and help with our current situation. Are there any, Rosetta?
I have a question. So part of our cybersecurity stuff is that our IS department will send out phishing emails or things that, like, if you click on them, you get this big, like, boom, like, you shouldn't be here. And it's just something that will bring to attention that these kids shouldn't be clicking on stuff. I mean, is there something like that we could do?
I can share that. Yes, we do that with adults. The students don't have the same level of access for that kind of thing. If they were to click on something that was inappropriate, they would get locked down. But yes, that's a good tool, and I am sorry to report we're not 100% on not taking the bait. Let's put it that way.
Any other comments or questions?
Quick one on that topic. I know the district is offering like a series on mental health for parents, which I think is fabulous. Thank you. I wonder if offering a class on how parents can help navigate the internet with their kids, because I grew up like many parents without the internet. This is the first generation, our kids, and it's like a new territory for us. I wonder if that might be helpful or something we could explore. I mean, I know it's a lot, but thank you for considering.
Thank you, Dean. Steffi, did you have another comment?
Well, I was just going to say, like, we are not off in an island by ourselves. Like, these issues are probably national issues. I'm sure MCIU, PSBA, others probably have resources that we could potentially tap into. I in no way think that we should be creating this stuff, right? I think we should be, using whatever resources are out there.
Thank you. Anyone else? Okay, well then can we have a motion to adjourn?
So moved.
All those in favor?
Aye.
Aye.
Anyone opposed? All right, have a great evening, everyone.